Call to the member for Bruce.
Thank you, Mr Speaker. My question's to the Minister for Health. How will the Albanese Labor government's tax cuts help healthcare workers keep more of what they earn? How is the government delivering on its commitments to strengthen Medicare, and why is that needed after a decade of cuts and neglect?
Call to the Minister for Health and Aged Care.
Thank you, Speaker, and I thank the member for Bruce. There are 78,000 taxpayers in the electorate of Bruce, and on July 1st, Labor will deliver every single one of those taxpayers a tax cut to help with the cost of living. And I know the member for Bruce is also keenly interested to hear that every single one of the 73,000 taxpayers in the nearby electorate of Dunkley will also receive a tax cut, like a second-year registered nurse at the Frankston Hospital who will receive a tax cut of more than $1,550, double what she would have received under those opposite. Or a hospital orderly who will receive a tax cut of $862, Mr Speaker, compared to just $58 under the plan that those opposite had, or just $1 a week, Mr Speaker. These bigger, better tax cuts from the Treasurer and the Prime Minister build on all of the other measures that we've been putting in place to make it cheaper and make it easier to see a doctor in Dunkley, Mr Speaker, like the Frankston Urgent Care Clinic that has already seen 11,000 patients fully bulk billed, Mr Speaker, or the tripling of the bulk billing incentive delivered in last year's budget. Now, I'm asked about the last decade, and I noticed, Mr Speaker, the Leader of the Opposition out in the last couple of weeks boasting about his record on bulk billing, that it was over 80% when he was the Health Minister, Mr Speaker. Of course, he didn't mention he then tried to abolish bulk billing altogether. He didn't mention he then froze the Medicare rebate, ripping billions of dollars out of general practice. But, Mr Speaker, that's only one recent example of the Leader of the Opposition not being quite straight about the last decade in health policy. There's also an ad circulating, Mr Speaker, called Peter Dutton Delivers as Health Minister. It's only got 2 engagements so far, 1 like and 1 laughing face emoji. Not sure whether it's laughing at you or with you, but fair to say it hasn't exactly gone viral this far. But another remarkable thing about this ad, Mr Speaker, is the Leader of the Opposition has got a very big smile on his face, which made me think immediately maybe it's one of those deep fake AI thingamajigs. Not sure. But the most remarkable thing about this is the Leader of the Opposition appears to be taking credit for there being 100 headspace services in place when he was the Health Minister, which sounds pretty impressive if you ignore the fact that 90 of them had been funded and rolled out years before by the Gillard government, Mr Speaker. The truth is, the only thing this man delivered as Health Minister, Mr Speaker, is cuts and chaos, and every Australian remembers it.